Hello, Uganda. My name is Mwanguzi Shadrach from Health Touch Uganda. Today I'm going to be addressing something very important. We are in a situation where it's not very easy for everyone to access health facilities because of the public transport system, which is currently down. But still, there are many things which happen, and some of them you need to do something within the first few minutes, maybe 30 or 1 hour, and yet it may take you more than that time before you access a health facility. And that's why I'm going to be talking about the forms of first aid that you can give in different situations the whole of this week. Today I'm going to be focusing on burns. Burns are very common and they affect a lot of people. Every year, about 180,000 people die from burns. But surprisingly, the biggest number are people from the low income and middle income countries. For example, most of the individuals affected are children under 5 years. But for every child that dies from burns in the high income settings, there are 7 of them who die in the low and middle income countries. That's why it's very important for every one of us to know what to do just in case there is a situation where someone has been burned, someone is burning up, so that will prevent the severe damages that may come as a result of these burns, even as we plan to go to hospital. So, I'm going to be talking about what you should do and then some of the things that have been done for some good time and are not good, and I'll be discouraging them in this video today. So, when you are in a situation where maybe someone is burning up or even yourself, the most important thing to start with is to ensure the burning process stops, to extinguish the fire. So not everyone has a fire extinguisher, but there are other mechanisms through which you can combat this fire. One, take off the burning cloth or take off the clothes, and if it's not possible, maybe it's a huge flame, then you can roll on the ground. That helps in breaking off this. And then if it's not possible, you can get a large volume of water and then you pour on the person who is burning. And if that is not possible still, you can get a blanket, you can get something thick, and then you cover the person who is burning. That will help in stopping the burning, and then you uncover the person, because if you leave it there for long, they may end up suffocating. But those are some of the ways through which you can stop this fire. But make sure that before you do that, you as a person helping, make sure you are safe and your environment is safe, because your life at that time is priority. If you don't take that into consideration, you may rush, you get yourself into problems, and you fail to help the other person, and yourself get affected as well. So if you want to give the best first aid, make sure you are safe as a first aider, and then you go ahead and give the first aid. So after stopping the burning, the next thing is cooling the place that has been burnt. Preferably we use running water. You can put the burnt surface or the burnt part of the body under running water until when the person feels a bit of relief. This is done usually between 10 minutes to 30. Make sure you don't overdo it, because if the more you do it, the more the victim is at risk of developing low body temperatures that may actually also be disastrous. So after cooling, you can try cooling under running water, but if you don't have it, you can just put water in a container, a basin, a saucepan, a bucket, or any other form of container, and then you dip the burnt part in that water until when you get a bit of relief. If you can't get that still, you can just get, maybe you can soak a piece of cloth, sponge, and then you pad the burnt part until when the person gets a bit of relief. If the burnt area or burnt part of the body is dirty, just clean it with some water with soap and pat it until when it's dry, and then cover it with a clean piece of cloth, maybe a bed sheet, something that's clean. Wrap it around, and if the burns are very severe, the burns have gone up to the deeper parts of the skin, then you need to cover the person up to ensure they don't become cold, because the moment they become cold, they will even have other issues. And if the burns are still very deep, the person or the victim is at risk of shock. Shock is a state where you don't have enough blood reaching the different parts of the body, and one of the things we fear most in those very deep burns is the victim getting into shock. So to avoid that, even as you plan to transport this person to hospital or to a health facility around, make sure they are lying flat. If you can raise their legs, it's better. You raise their legs, let them lie flat, so you avoid that shock even as you go to hospital. Some of the things that have been done but are not so good, things of putting ice on the wounds. The ice makes the wounds deeper, and that means the wounds worsen. So avoid the use of ice. Some people smear certain things on the wounds. Some people use toothpaste, others use oil, others pound tablets and pour the powder on the wounds. Those are all things which are not good. The other thing, don't try to rupture the blisters. Blisters are the swellings that form on the top of some of the burns, and there is water contained within. So don't prick them, don't rupture them. It's better to rupture them when you have the lotion or the medicine that is going to be applied on the top of those wounds. If you don't have that lotion, if you don't have that medicine, just leave them. They will be ruptured in the hospital. Just in case they rupture by themselves, just clean the place with some clean water and soap, and dry it, and then just make sure you take the person to the hospital. If you have a painkiller, some tablets, let the person take so that they don't feel a lot of pain as you plan to take them to hospital. In a nutshell, I want to say burns are very common, but it is important for us to know how to help the people. And the most important thing to start with is stopping the burning process, cooling the place that has been burnt, cleaning it, and wrapping it with a clean piece of cloth, making sure the person is kept warm, maybe with a blanket, and then if you have a painkiller, take to reduce on the pain as you plan to go to a health facility. My name is Mwanguzi Shadrack. Let's touch Uganda. Follow the light.